It's descending onto the Inkosi Luthuli International Convention Center for the South African AIDS Conference. Our reporter Vusi Khumalo is there, and he's about to tell us about this march that we're told will be led by the Deputy President in his capacity as the chairperson of the South African National AIDS Council. Vusi, what's happening on your side?
Good morning, Blaine, as well as to the viewers at home. Yes, welcome to Durban. This is the 9th AIDS conference here in Durban in South Africa. There are quite a lot of people here who are very, very eager to be part and participate in this march. We are at the first day of the conference, which will take place as from today up until Friday. It's a 4-day conference. There are so many people, as you can see in my background. They are holding placards aloft, saying that let's end gender-based violence, and also quite a number of issues that they are raising. With me here at the start of the march is Mr. Nobutalu, who is the executive manager of SANAC here in South Africa. Mr. Nobutalu, let's shift our focus to you. What are you hoping to achieve with this march today?
Thank you very much. With this march, we are hoping to promote a culture of human rights, a respect for diversity in the country, in South Africa, an end to gender-based violence, an end to stigma, an end to discrimination. Our forefathers and foremothers in the Freedom Charter envisioned a South Africa which is characterized by peace and friendship. Our country now, as things stand, is very far from moving closer to that vision of our foremothers and our forefathers. South Africa is one of the most advanced constitutions with the Bill of Rights, but what happens on the ground is very different from what the Constitution points us to or leads us to. So we know that, for instance, this culture of not respecting the human rights of others is fueling the HIV/AIDS epidemic in the country. And there are many researches which point to that direction. So the South African National AIDS Council has as one of its goals the promotion of human rights, to have a culture of human rights. And during this AIDS conference, we will be launching a plan or a strategy that is resourced, that is going to begin to deal with issues of human rights, especially at an implementation level. If I give you an example, some of the pillars would be the sensitization of the criminal justice system, the police and others to be able to respect human rights. Even health professionals need to be sensitized, because we would like to we can only move towards an end to the HIV/AIDS epidemic in South Africa if we do that on the platform of the respect for the human rights of fellow citizens.
As one of your mandates you've just mentioned, that is to foster dialogue between government, civil society, as well as other groups. Are you happy with the way things are going, especially with the response to government on matters of HIV/AIDS?
South Africa, as you are aware, is one of the biggest HIV/AIDS burden, or we call it a pandemic in the world, with more than 7 million people. We have one of the biggest treatment program for HIV/AIDS in the whole world. So there is a lot that government is doing as far as that issues, and many South Africans know their status. But what we begin to see is that the people need to get a message. For instance, those who are on treatment, to be able to continue to take their treatment every day as prescribed by the health professionals. We are seeing many people actually dropping out of treatment and consequently showing up at the hospitals in a situation which is very dire. But with the treatment that is in the country, people can live long, healthy and productive lives. So this is what government is doing, and the treatment in South Africa is actually free of charge. So this is part of it. So as SANAC, we're quite happy with the program of government. We are quite happy with civil society, because civil society is coming to the party. We are working very hard with the private sector. They're also making a contribution, but we need to work a little bit harder as far as that is concerned. But our message is to South Africans. I think we shouldn't say government this, government that, because government belongs to the people of South Africa. And a lot of what needs to be done by ordinary South Africans. So this march is more a call to ordinary South Africans to respect diversity, to live according to the spirit and the letter of the Freedom Charter and the spirit and the letter of our Constitution in terms of respecting the rights of other people.
Are you happy with the response of the people? I can see not quite a lot of people who are here today, including some of the politicians who were expected to be to lead the march side to side with some of the activists here.
Well, we were hoping that the Deputy President is going to be leading the march, but we received the information that he's committed, but he has given it a thumbs up, so he's very much with us. When I look at this response here, I think the most important thing is the message that we are going to be passing over to all the people on the streets here, and especially the message that you, as the media, are sending out there to the public, to ordinary South Africans. We think that this is a huge success, because the message is going to go out. Not only will the people of eThekwini read these messages on the posters here, but these messages on the posters, thanks to the media, are going to be read by many millions of people, and they are being read by millions of people all over South Africa. We are hoping for a very positive response, for an end to gender-based violence, South Africans to begin to respect the human rights of others and respect diversity. Even though someone is different from us, even though someone is vulnerable, is in a difficult situation, they are there for all of us to embrace them and to help them, not to take advantage of their vulnerability.
Okay, another issue when you talk about HIV/AIDS is the problem of stigma. Are people beginning to be open about their status of HIV/AIDS?
They are. And as you can see, the march is leaving from King Dinizulu statue. It's going to end up where the launch of the human rights strategy is going to take place at Gugu Dlamini. Gugu Dlamini is a very sore kind of a story in the life history of South Africa, because she's a young woman who was brutally killed because she dared to disclose her HIV/AIDS status. And we are seeing more and more people. When we look at the number of people who know their status, the numbers are quite increasing, more than 80%. So we are at a situation where we are calling upon all South Africans to be able to live by the culture of human rights and to respect the human rights of others. And when it comes to people disclosing their HIV/AIDS status, I think there are many of them who do that. As we are here now, there is a conference taking place, what we call a pre-conference, of people living with HIV and AIDS. What we realize is that those people who are HIV positive and they disclose their status, they are not afraid to disclose their status, they live much more freely, and they live longer, healthy, productive lives. So I think we are calling upon people to take advantage of all the services that are available by the government, by the private sector, and by other civil society, so that together we can be able to end this biggest epidemic that has hit our country.
Okay, thanks a lot, sir. That's Mr. Zone Butalu, who's the executive manager for SANAC here in South Africa. The march is about to start. We'll start here from this very venue up until Gugu Dlamini Park. As you know, that Gugu Dlamini Park is one of the landmarks here in Durban, of which, as Mr. Nebalu did say, that did allude to the fact that she was killed years ago due to her status of being HIV positive. So Mr. Nobutalo also confirmed to us that Mr. Deputy President David Mabuza is not going to take part in today's march due to commitments elsewhere. But we are also expecting other government officials, starting from the Premier of KwaZulu-Natal, Sihlezi Galala, as well as Health Minister Vusi Mkhize, to be part of this march from here at King Dinizulu Park up until Gugu Dlamini Park. It's back to in studio, Blaine.
Vusi, thank you very much indeed for your reporting. Stand by. We'll try to catch up with you in about 15 minutes or so just to get an update with regards to this march. It is indeed an important march, an important conference, and by all accounts, hands on deck, all hands on deck in order to, foster greater achievements and foster greater unity in order to try and break through some of the stigma that is still prevalent in South Africa.
But not just the stigma, also the latest advancements in terms of technology, in terms of medical procedures, in terms of how to work around this big problem.
Exactly. Technology is one of the key aspects that this conference will be focusing on. It's a huge task as well. We know that reportedly 31 million people worldwide live with HIV. Here in South Africa, it's around just over 7 million.